Hello, everybody. Welcome to session 5 of this incredibly instructive and diverse day that we've had discussing all things sepsis and all things excellence in diagnosis. This is the final session, and it's going to be a little bit of a wrap-up and a roundtable. And in this roundtable, we are trying to think about a set of broad stakeholder views on the overall question of excellence in diagnosis and sepsis in particular. And so I'm really delighted to introduce you to our panelists. We have Daniel Yang from the Gordon and Betty Moore Foundation, who will speak on behalf of the Gordon and Moore Foundation, but also thinking a little bit about the perspective of funding agencies funding research pertinent to this area. We also have Laura Evans, who was one of the chairs the last session. Laura is an intensivist at the University of Washington, but is also one of the co-leaders of the Surviving Sepsis campaign, and will speak on behalf of the professional community and the professional guidelines community. We have Christine Gosho from MedStar Health. Christine is going to speak very much on behalf of the perspective of large healthcare systems and thinking about the patients and the family members that these healthcare systems support and provide care to. We have Foster Gueston, a healthcare consultant who was formerly the chief medical officer at New York State, responsible at the time for introducing the New York RORI's regulations, the guidelines on trying to improve diagnosis and quality of care for sepsis across the state of New York. And he will obviously think about very much the perspective of government bodies in the role of trying to advance healthcare excellence. And then finally, we have Michael Howell, who is also originally started out as a pulmonary and critical care physician, but moved from an academic background to work for an even more academic background, Google Health, and will speak a little bit on behalf of not just Google, but try to think about the perspective of technology companies and their role in advancing diagnosis and excellence in health. So panelists, welcome. We could have a complete free-for-all discussion, and certainly we want to circle back to any question that comes up from the audience and to some themes that have emerged during the day. But I do want to set the session up with some 5 thoughts that we had even before the day began. And I'm going to, after introducing these, I'm going to ask each of our panelists to make some introductory remarks. So to the audience, let me tell you the 5 broad things we were thinking of, and each of the panelists might comment on all 5 or on 1 or 2 of them. The first thing is to ask, what would success look like in sepsis diagnosis? In 10 or 15 years, in what way could we all look back and say, wow, we were really having a problem in 2020, but now we've really made significant improvements, and now we can say that we've made measurable, demonstrable success in sepsis diagnosis. The second thing is, what resonates from these different stakeholder perspectives as the major obstacles or barriers that are getting in the way of demonstrating success? The third is, how would you solve it? If we gave you $10 million or $100 million, how would you spend that money? What's the first thing you would do? And this is to try to focus us on concretely, how would you spend money in the next 12 months to move the needle? The fourth thing would be, how would you assess progress? We can imagine some halcyon day where we simply say sepsis diagnosis is perfect, but between now and then, what are the measures or the yardsticks by which we would measure success? And then the final thing I would say is, while some of this might be unique to sepsis, Are there particular themes that are coming up that feel cross-cutting and that might also pivot to be just as useful when thinking generically about the role of diagnosis in all of medicine? So coming back to the very opening session of the day and thinking about universal themes, both about success and about barriers and about strategies to achieve success that would not just, that for which sepsis would serve as an exemplar, but that they would in fact have equal relevance in other areas. So without further ado, those are the sort of the 5 points that we would love to circle back to in this hour, if no one else has any other questions from the audience.